So basically, this is a brief class on suture materials, which is both fundamental and basic for all medical graduates, people appearing for NEET PG, Central Institute examinations, actually especially for Central Institute examinations. So I'll be talking about all the suture materials. In short, I'll be showing the images of the same, classifying it to give a broad purview of the same. So to classify, it's classified as absorbable and non-absorbable suture materials broadly, and under each of these there are both natural and synthetic. The first thing that might arise in anyone's mind is, why is there synthetic and natural? Why can't we just have natural materials? Is basically on how it gets absorbed. Natural suture materials gets absorbed in one of these three ways, either via inflammatory degradation, phagocytic degradation, or more commonly catalytic enzymatic degradation. All three modes are unpredictable and their rate of absorption does not remain the same. Like for example, when you take enzymatic or catalytic absorption, it is slow to begin with, but once the enzymatic catalysis starts, the rate of absorption becomes multiple times the initial rate. So it's unpredictable, and the absorption cannot be predicted on when it's gonna till how long it's gonna last in the body. So here comes the picture of synthetic materials, wherein the absorption is more predictable because it is by hydrolysis. It's by hydrolysis. So the rate of absorption is linear curve and more predictable. So coming to, I'll just list out all the examples under each of these and then go on to individual ones. First is absorbable natural synthetic suture materials. They include catgut, chromic catgut, and kangaroo tendon. And synthetic absorbable include vicryl, monocryl, dexon, maxon, PDS, biosyn. Coming to non-absorbable, those that remain permanently in your body are natural, include cotton, linen, silk, and nylon. All these are like textile materials. And synthetic include polyethylene, polypropylene, polyester, and steel. So coming to the first one, that is absorbable natural. The first one is catgut. It is made from the submucosa of jejunum of the gut of the sheep. Yep, it's the sheep. It's from the gut of the sheep. So I usually remember it as sheep gut than cat gut, because usually graduates get confused as it's derived from the gut of the cat, but it's actually from the sheep. The strength remains for 7 days on average, and it's no longer used mainly for two reasons. First, because of its short duration of stay in the body, and secondly because it causes reactions. Because why? Because it's organic material, and organic materials are prone for reactions in our body. Next is chromic catgut. It is the same, that is from the submucosa of jejunum of sheep gut, but here it is along with chromic salts. The material is dipped in chromic salts. So it is soaked in chromic salts. Why is it soaked in chromic salts? Because it increases the preservative action of the chromic salts, helps in increasing the duration of stay in the body. That increases the strength of the chromic catgut, and it increases by 3 times, that is 21 days. Uses, it's used for superficial surgeries, surface surgeries like circumcision, and it's also used for gut anastomosis and few GUT procedures, genitourinary tract procedures. Next comes kangaroo tendon. So this is how chromic catgut material looks like. It has a yellowish hue to it, and it's chromic nowadays, not just catgut. Material of kangaroo tendon is from the tail of kangaroos, hair obviously, fur rather. Strength is similar, up to 2 weeks approximately, and it's no longer used. It's just for theoretical purposes. So we finished the absorbable natural. Now coming to absorbable synthetic. The first one is vicryl. Here I would like to tell you how to read a suture material when you get it in wherever it is in a setting, the procedure room, casualty, OPD, wherever you are doing it. How to basically read it is, this includes the company. This is the company of the suture material. This is what suture material it is in bold and big font. And it can be either coated or not coated. Coated includes either to prolong its life by a preservative, or using an antibiotic coating. And here it tells if it's braided or not. Braided is usually multiple threads woven into a single stronger thread. This is called braiding, whereas not braided is a single filament. This indicates the needle, the actual real life size needle, how it looks like. So if if the image indicates 2 centimeter from here to here, here to here, then it is actually 2 centimeter in real life as well. And this one indicates the size of the suture material, number 1 size. It's one of the biggest, and this is the length of the suture material, and this here usually comes the expiry date and the lot number or the trademark number. So this is how you read a suture material. And coming to the material, what it is made of, it is usually called Vicryl 910 because it's a combination of glycolide plus lactate at the ratio of 9:10:90. Glycolide plus lactate 9:10:90, and this name Vicryl was given by the company Ethicon. Strength remains for 6 weeks, which is pretty good, and it is used for many things, and most commonly it's used for subcuticular suturing or subcutaneous tissue suturing. It's used for suturing muscles. Bear with me, it's not the tendons, it's muscles. For tendons, it's polypropylene. It's used for suturing muscles, and then used for also used for suturing gut ends and port sites, laparoscopic port sites. These are some of the uses of Vicryl. Next, monocryl is similar to Vicryl, except that it's made of polyglycapron. To spell it out properly, it is polyglycapron. So the polymer of this is called as monocryl, and that is the material. Strength remains approximately for 6 weeks, and it's used for subcuticular suturing. Example in face, breasts after removal of a tumor. Next is Dexon. Dexon is, I usually remember it as D double, that is braided. Maxon M, that is mono, that is monofilament. Dexon is made of polyglycolic acid. And it's a braided monomer. Strength is monomer versus dimer is nothing but how many elements make up the suture material. If it is a single element like polyglycolic acid, it's called a monomer. The monomer. Whereas Vicryl is made of 2 materials, that is glycolide and lactate. So it's a dimer. So this is how Vicryl looks like. Usually purple. The material itself is also purple. Usually Vicryl is remembered as violet. As you can see, monocryl is amber colored. Dexon is brown. Maxon is white. Maxon is polyglyconate. The material is polyglyconate. Strength remains and uses remain similar to Dexon, and whose uses remain similar to Vicryl. So if you remember Vicryl, you can remember other absorbable suture materials. And polydiaxanon is a very important suture material, and it is nothing but polydiaxanon suture. Polydiaxanon suture. It's the one weird thing about this is that the covering of this is in gray, but the suture material itself is violet. It's like I said, it's polydiaxanon. The material is polydiaxanon. It's a monofilament, and it has very high memory. The strength remains, that T half or the duration for which it stays is very high. That's 180 days, and uses it's used in uses similar to Vicryl for gut anastomosis, biliary surgeries, etc. Biocin is a polymer of polyglycolic polymer. It's called as glycomer, glycolic acid polymer. And It's red in color and it's very rarely used. Strength remains for 4 to 8 weeks. Used in smaller sizes like 30, 40, finer surgeries, and uses are similar to again Vicryl. So if you basically remember the uses of Vicryl, you will remember the rest of the observable synthetic material uses. Coming to non-observable suture materials, all these are very simple. All these are textile names. It's made from cellulose of cotton pod. Strength, all the duration of stay of the natural non-observable material is obviously infinite because it's non-observable. But one thing you should remember, when you put cotton in water, strength increases. It's called a capillary effect of cotton. It absorbs the cotton to become thicker and with increased strength. Cotton rarely used these days because it is natural and prone to increased infections. Next is linen. Obviously the material is linen. More specifically to say, it is from cellulose of flax plant. Strength is infinite, not affected by water, and uses are rarely used these days. Natural, observable, or non-observable are not used these days except for silk, and silk I'll tell you why. Nylon, the silk is made from the cocoon of larvae of silkworm. Cocoon of larvae of silkworm, and the protein, this is a repeated question asked in NEET, and that is it's made from sericin. It's made from sericin protein. Strength remains obviously infinite, but when you put it in water, the strength reduces. This is one peculiar quality of the silk, and the uses include for fixing port, fixing drains, port closures, etc. And because of this effect, in which its strength reduces in water, it's never autoclaved. Nylon again is made from it's a synthetic material actually. Nylon, synthetic non-absorbable material, put in here wrongly, rarely used for skin closures. Coming to synthetic more predictable absorption suture materials, polyethylene or polyamide is green color, most commonly used when you come to housemanship, and it's green, and then more commonly known as ethylene, even though it's actually polyamide. Used for the material, as I told, is polyamide. Strength is infinite, and used for skin, most common size used is 20, whereas for face it can range from 30 to 50. It's braided. Most of the suture materials are braided except for very few, so I'll list out the monofilament suture materials soon. And the suture material is black in color, as you can see, and usually RCN or reverse cutting type needles are used in for polyamide, that is ethylene, mainly for skin suturing. One weird effect which ethylene shows is called as wick effect. It was observed in ethylene. When braided suture materials are sutured through the skin, the commensals of the skin are pushed into the subcutaneous plane and result in SSI or surgical site infection. This is called as wick effect. Polypropylene is purple in color, P for polypropylene, purple in color, and material, the name itself says, is proline. The material is called as proline, and the suture material is called as proline, and the material itself is polypropylene. Strength is infinite and used for hernia surgeries, herniorrhaphy, that is used for closure of laparotomy wounds. In this I am trying to say to approximate the recti. So any other suture material, or if this itself is used in a lax form, it causes divarification. And lastly, it's used for cotton colon or rectal surgeries, rectal approximations. Whereas the suture material is purple, polypropylene or proline mesh itself is white in color. So don't get confused when you see a white netted image asked in exam. It will be proline mesh itself, but it's not purple. Stainless steel, as it said, the material itself is made of stainless steel. It's infinite except when you expose it to a lot of water, and used in CTVS for sternotomy closure. Or any bone approximation. So these are basically all the suture materials available. And to give a quick summary, what is used for gut? Vicryl. What is used for vessels? Suture material of choice for vessels, it is polypropylene. And then the last name few monofilaments. They include polypropylene, polyester, PDS. These are some of the monofilaments. And then they'll ask what is an ideal suture material. They should stay for long, less tissue reaction, not degraded in the presence of organic tissue, less elastic, that is less memory, less leaking effect, increased knot security, economically available, and causes reduced inflammation. The list can go on, you can add any number of things, but these are the main things for ideal suture material. So thank you for patiently listening to the class. To quickly wrap up, this is the classification I told you: observable, non-observable, and under each of this is natural and synthetic. Observable, natural include catgut, chromic catgut, kangaroo tendon. Synthetic observable include vicryl, monocryl, dexon, maxon, PDS, biosin. Natural non-observable include all the textile materials that include cotton, linen, silk, and synthetic includes polyethylene, polypropylene, polyamide, polyester, steel. And thank you for patiently listening to the class. This is Suraj, Dr. Suraj signing off. Have all the best for your exam.